Hi, my name is Laurel Nichols, and I'm here to talk about the strategic plan and evaluation for the current initiatives at Denver Health and Hospital Authority. The objectives of my presentation today include providing a basic background on the organization as well as an overview of their mission and values. I'm going to introduce the basis of the strategic goals as well as the goals themselves and discuss some of the evaluation measures and ways to determine success. Denver Health came to be in 1860. There are all sorts of theories about how it started, but ultimately there was a decision that the area needed health care with the gold rush that was happening. Since the beginning of Denver Health, it has grown to a facility with 525 licensed beds. It's the region's only ACS verified adult level 1 and pediatric level 2 trauma center. The organization operates Denver's 911 emergency system and has a fully functioning paramedic division, the only healthcare system in Denver that has that. We operate 9 family health centers and 17 school-based clinics, and we are the only hospital in the United States that owns and operates the public health system, and that includes communicable disease services. We have a national poison and drug center, and we're ranked in the best 10% of academic hospitals for inpatient survival 7 years running. Denver Health has a lot of good things going on. The mission of Denver Health is to provide access to the highest quality health care, whether for prevention or acute or chronic diseases, regardless of ability to pay. I think most healthcare organizations have a similar mission, but the last part, regardless of ability to pay, is unique to a facility like Denver Health. The organization has the vision of being the healthiest community in the United States, and to help promote that internally, they do all sorts of incentives for employees that are willing to walk, bike, or take public transportation as opposed to drive. Right now, the focus is to make Denver Health a place that employees would proudly recommend to friends and family. And we're not there yet. We have a lot of things left to do. Today we're going to talk about compassionate service, continuous improvement, fostering innovation, being dedicated to excellence, and growing and getting stronger through collaboration. These are really the crux of what Denver Health needs to do to continue to grow and be the facility they'd like to be. So what do our patients want? The number one thing patients want is not to be harmed while they're in the hospital. Hospitals are full of disease and germs and all sorts of bad things. We want patients not to fall. We don't want them to acquire infections in the hospital, and we don't want adverse outcomes to surgeries and other procedures. Patients want excellent service. They want to be able to access the care that they need in a timely fashion. Timely fashion being the operative words there. And they want innovation. If they're sick and they need new treatments to make them better, they want an organization that's willing to help find those things. Medical staff are there to provide care for the patients. To get them and keep them, we need to have effective recruitment and onboard them effectively. Training and onboarding are really key. We need a mentor program where they have someone that they can look up to and learn from. They'll want opportunities for leadership development. Obviously, compensation is key, but really one of the most important things is having engaged and present leadership. They want to see the leaders in the facility making a difference. Employees don't want a lot of things different than that. They want career growth and professional development. They want adequate staffing. They want the right staff to patient ratios so they can do the right thing and care for people the way they want to. Just like the physicians, they want mentoring and competitive pay. They want an environment that's nurturing and present and engaged leadership. Communicating our plan to our stakeholders, we're going to use the intranet. We'll be emailing staff. We'll have safety fairs and other educational events. Quarterly town halls are an excellent way of communicating and allowing dialogue between leadership and employees. and those will be part of the plan. We have to have a presence and do formal reporting at our board meetings so that we're communicating upward to those stakeholders and not just downward to the stakeholders that are working in our organization. We need to have a balanced scorecard developed, and we need to distribute that appropriately. We'll be deploying multi-message displays throughout the facility to scroll messaging and have a way to deploy new initiatives to staff. We'll use paper publications, although not often, as people are often concerned about resource usage in this area. Social media is a good way to get messages out to external stakeholders, and obviously regular staff meetings will be taking place, and we'll push information down through leaders to their staff. With regard to evaluation, medical staff and employee evaluations are key to hear how your people feel, and we frequently reach out just individually and ask for feedback. They don't always have to be formal evaluations. Focus groups are an excellent way to talk over things and brainstorm ideas. Data collection and analysis is an interesting point. We need data to determine if we're doing the right thing, and we want to see some of our bad data go down and our good data go up, and I'll talk more about that in a moment. But part of that is looking at what we didn't do wrong to determine that we're doing something right. I like to call that measuring success by lack of failures. I don't like those lagging indicators, but it's the nature of the beast. We're going to use staff satisfaction scores, and those are done every 6 months to see if we have issues that we need to resolve. We'll monitor website traffic for patients and external partners, and really, at the end of the day, all of our efforts from staff level all the way to patient should impact patient satisfaction scores positively. And that makes us a better place to get treatment, and it impacts our bottom line because it impacts our Medicare and Medicaid reimbursements. From a practical perspective, we're going to look toward 5% reduction in negative metrics, and we'll evaluate it each year. We're going to have an expectation of 5% increase in positive metrics, so an overall 10% difference between negative and positive. We'll evaluate periodically, not just once a year, but annual recalibration and goal analysis is going to take place.